Hello, everybody. We are here to introduce you to medical nutrition therapy. So, might as well start with the definition of nutrition. What do we understand when we hear the term nutrition? Okay, nutrition is the science that interprets the nutrients and other substances in food in relation to maintenance, growth, reproduction, health, and disease of an organism. It includes food intake, absorption, assimilation, biosynthesis, catabolism, and excretion. Okay, the diet of an organism is what it eats, which is largely determined the availability and palatability of the food. For humans, a healthy diet includes preparation of food and storage methods that preserves nutrients from oxidation, heat, or leaching, and that reduces risk of foodborne illness. The seven major classes of human nutrients are carbohydrates, fat, fiber, minerals, proteins, vitamins, and water, which we have already discussed in your advanced nutrition. Okay, nutrients can be grouped as either macronutrients or micronutrients they are needed in small quantities. In humans, an unhealthy diet can cause deficiency related diseases such as blindness, anemia, scurvy, preterm birth, stillbirth, and cretinism or nutrient excess, health threatening conditions such as obesity and metabolic syndrome, and such common chronic symptoms. Systematic disease are cardiovascular disease, diabetes, and osteoporosis. Undernutrition can lead to wasting in acute cases and the stunting of marasmus in chronic cases of malnutrition. So, as we know, nutrition is important in order to understand how the body will function after the intake of certain nutrients in your body. Next, we go on to medical nutrition therapy. Now, what is medical nutrition therapy? Medical nutrition therapy is a therapeutic approach to treating medical condition and their associated symptoms via the use of specific tailored diet devised and monitored by a registered dietitian or a nutritionist. The diet is based upon the patient's medical record, physical examination, functional examination, and dietary history. Okay. The role of MNT when administered by a physician or dietitian nutritionist is to reduce the risk of developing complications in pre-existing conditions such as type 2 diabetes, as well as ameliorate the effects and any existing conditions such as high cholesterol, etc. Registered dietitians started using MNT as a dietary intervention for preventing or treating other health conditions that are caused by or made worse by unhealthy eating habits. On the other hand, medical nutrition is a broader term describing nutrition in a medical context. So now taking care of your nutritional needs goes on to the dietitians. Okay, so now we go into the definitions and role of a dietitian in a healthcare. The dietitian is an expert in dietetics, that is human nutrition and the regulation of diet. The dietitian alters the patient's nutrient basis, diagnose and treat nutritional problems. So, dietitian or registered dietitian nutritionist is a dietitian who meets all of set of specific academic and professional requirements, including the completion of a bachelor's degree with the accredited nutrition curriculum and internship at an approved healthcare facility, food service organization, or community agency, and satisfactory performance on a registration exam. Okay, so most of you normally know that what is the role of a dietitian, or how do you define a dietitian. Okay, so I won't go much into those. Let me tell you where do most of the dietitian practice. Okay, so there are clinical dietitians. Clinical dietitians are them who work in hospitals, outpatient clinics, nursing care facilities, and healthcare centers to provide nutrition therapy to patients with a variety of health conditions, and provide dietary consultations to patients and their families. They confer with the other healthcare professionals to review patient medical charts and develop individual plans to meet their nutritional equipments. Okay, they also manage to give you your enteral feed formula or your total parental nutritional formula, parental enteral nutrition. These are all done by your clinical dietitians. For example, us, and you also in future will I hope will also be a clinical dietitian. So all the best for that. And next we go to community dietitians. Now what are community dietitians? Community dietitians work with wellness programs, public health agency, home care agency and health maintenance organizations. These dietitians apply and distribute knowledge about food and nutrition to individuals and group of specific categories, lifestyles and geographic areas in order to promote health. They often focus on the needs of elderly, children and other individuals with specific needs or limited access to healthy food. Some community dietitians conduct home visits for patients who are too physically ill to attend consultation in health facilities in order to provide care and instruction on grocery shopping and food preparation. They are more of like dietitians or nutritional workers in your Anganwadi projects and NGOs, all those sort of things. Okay, so they are the community dietitians. So next we go to food service dietitians. They are managers or responsible for large-scale food planning and service. They coordinate, access and plan food service processing in healthcare facilities, school food service programs, prisons, restaurants and company cafeterias. Yeah, so you can say midday meal program, ICDS, they are all your food service dietitians because they work in your school service. Okay. Next we have gerontological dietitians. Gerontological dietitians are specialists in nutrition and aging. They work in nursery homes, community-based aged care agencies, government agency in aging policy, and higher education in the field of gerontology, the study of aging. Yeah, you can see like some private companies, they have all this, gerontological dietitians and all. Next we go to pediatric dietitians. Pediatric dietitians provide nutritional and health advice for infants, children and adolescents. They focus on early nutritional needs and often work closely with doctors, school health services, clinics, hospitals and government agencies in developing and implementing treatment plans for children with eating disorders, food allergies, or any conditions when a child's diet factor into the equation, such as childhood obesity. Yeah, if you can say like some people who for example, let me tell you, some of your seniors might be working as a pediatric dietitians under some nutraceutical company like Abbott and all. So they are specific dietitians who are dedicated for your pediatric means children. Okay, up till 14 years of age they are known as pediatric children, boy and girl. So they provide diet chart for them. Okay, so they are specific dietitians for specific people. Next we have your research dietitian. Research dietitians may focus on social sciences or health services research. For example, investigate the impact of health policies or behavioral change or evaluate program effectiveness. They may survey food service system management in order to guide quality improvement. Sort of research dietitians by the topic, which is suggest like they go into research kind of thing. You also have it in your second year. So when you are doing your thesis and all, so you are doing a survey or a study and you are also a research dietitian then. Okay, so basically when you are doing your dissertation and all, so that is when you become a research dietitian. Okay, so well discussed. Now we will go into the meaning of the nutritional care process. What does it mean and what does it consist of? Okay, the nutritional care process is a systematic approach to providing high quality nutrition care. It consists of 4 distinct interrelated steps. Number 1 is a nutrition assessment. The dietitian collects and documents information such as food or nutrition related history, biochemical data, medical tests and procedures, anthropometric measures, nutrition focus, physical findings and your client history. Okay, anthropometric measures include your BMI, your BMR, okay, the muscle wasting, all those things. Nutritional diagnosis. Data collected during the nutritional assessment guides the RDN or your dietitian in selection of the appropriate nutrition diagnosis, that is naming the specific problem. Okay. Which means the data collected during the nutrition assessment guides the RDN in selection. Fine. So whatever the diagnosis is of the patient, based on the diagnosis and the data of his clinical findings and all, you give a nutritional diagnosis and then you do a diet chart on that. Nutritional intervention. The dietitian then selects the nutritional intervention that will be directed to the root cause or etiology of the nutritional problem and aimed or at alleviating the signs and symptoms of the diagnosis. Next is nutrition monitoring evaluation. The final step of the process is monitoring and evaluation, which the dietitian uses to determine if the client has achieved or is making progress towards the planned goals. Okay, so assessment, diagnosis, intervention and monitoring. So it's easy. You need to assess the patient, his nutrition related history or his clinical history or his biochemical data, medical test. Okay, on that you can get the clinical findings, then you get the diagnosis. For example, if the patient is suffering from diabetes, okay, and he is having a CVG of, let's say, which is more than 140 mg per dl. So basically you will diagnose the patient as a diabetic patient and then you intervene a diabetic diet which is low in your carbohydrate and fat and moderate protein for the patient. And then you give the patient that diet which he or she is supposed to maintain. Then you go to monitor the patient, like how is he or she doing after taking the diet, whether his glucose content, capillary blood glucose has decreased or not. Okay, so these are the steps. Using the NCP does not mean that all clients get the same area. Use of a care process provides a framework for the dietitian to individualize care, taking into account the client's needs and values and using the best evidence available to make decisions. Other disciplines in healthcare include nursing, physical therapy and occupational therapy have adopted care process specific to their discipline. Yes, besides the diet and all, there is always the physical therapy if the person needs or if the patient needs. Okay, so according to the patient needs, they are listed and they are given to them. Last line which says that at first the nutrition care process may seem like a linear approach. However, during the course of interaction, appointment with the client, the dietitian will often complete the assessment and diagnosis step and may begin a nutritional intervention when a client reveals another piece of new assessment data information that will cause the dietitian to reassess, re-diagnose and perhaps modify the plan that she has started discussing with the client. Yeah, so I took an example of a diabetic patient which is who is having a CVG of higher than 140 mg per dl. Now during his hospital stay, you found out that the patient is having a high of his BUN, okay, blood urea and nitrogen, that urea creatinine is high in the patient. Then the patient is being referred to a nephrologist and you find out that he is in his initial stage of chronic kidney disease. So now what you do is you go again and you re-access the data of the patient, okay, and then you also give a diet which is low in protein. Since he is a CKD patient, you give a diet which is low in protein and also low in carbohydrate because he is also a diabetic patient, and you implement it on the patient and then you keep monitoring the patient. Okay, so this is how it works. So you visit the patient on a daily basis, like what we do in our hospitals, like we visit the patient on a daily basis, we check the reports of the patient, whatever the complication he has been facing, what are the new diagnoses that he has been diagnosed. So according to those, we make dietary modifications in the diet. Next, we go on to see the dietary needs and disease processes. Normally, individuals obtain the necessary nutrients their bodies require through normal daily diets that process the foods accordingly within the body. Nevertheless, there are circumstances such as stress, and so on to may prevent the body from obtaining sufficient nutrients through diets. In such condition, dietary supplementation, which is specifically formulated for the individual condition, may be required to fill the void created by the specific condition. This can come in the form of medical nutrition. So here basically they have tried to describe the concept of nutraceutical products. Okay, nutraceutical products are those products which contain a specific type of amino acid or carbohydrate or high fiber or low fat or like that, which you need, which are given as a dietary supplement to your patient. Okay, so they help to they help to fulfill the nutrient deficiency for a patient. For example, if there is a vegetarian patient, okay, and that patient requires high protein diet, as in albumin, okay, high albumin diet. So the vegetarian patient is not going to eat your egg white. So what you do is you give a substitute of an egg white in the form of albumin care or albumin RRT. Okay, this is a nutraceutical product which you can buy. Okay, it is always prescribed by the dietitians. So a dietitian prescribes an albumin RRT or an albumin care, and according to the dosage that you have decided for the patient, it is supposedly to be consumed by the patient in order to fulfill the albumin content in the body. Now, the administration of dietary needs. In most cases, the use of medical nutrition is recommended within international and professional guidelines. It can be an integral part of managing acute and short-term diseases. It can also play a major role in supporting patients for extended periods of time and even for a lifetime in some special cases. Yeah, patient with enteral feeding and TPN, these are your special cases. Medical nutrition is not meant to replace the treatment of disease, but rather complement the normal use of drug therapies prescribed by physician and other licensed healthcare providers. Yeah, you cannot, it's like, you see, they go hand in hand. Nutrition and medicine goes hand in hand. So you cannot replace medicine by nutrition, and nutrition cannot be replaced by medicine. So that is what they are trying to say. Advantages. The following advantages come with medical nutrition. Medical nutrition can benefit people with various medical conditions such as cancer, COPD, diabetes, mellitus, eating disorder, food allergies, gastrointestinal disorders, immune system disorders such as HIV, AIDS, inherited disorders, metabolism, involuntary weight loss, kidney disease, sarcopenia, surgery, recovery, pregnancy, osteoporosis, ulcer, and so on. It is often very effective in treating type 1 and type 2 diabetes. Yeah, many diabetes, because they are all dependent on the carbohydrate content, So it can help one to live better at any age. Yeah, obviously, if we maintain a good diet, it is always acceptable to have a good diet because it will lead to a healthy lifestyle. Disadvantages. There are some disadvantages of medical nutrition. The patient may need to follow a strict diet to see benefits while using a medical nutrition plan. That is where your counseling part will come. Okay, so if you're good in your counseling, then you will always be able to make the patient understand so as to why the particular diet is important. Some forms of medical nutrition can be very expensive. Yes, true. A poor patient may not afford such. Yeah, for in case of, as I already told you, for example, a veg patient requiring albumin rich food, Okay, and you have your renal patient who have renal impairment, but they need to get a proper amount of protein. So those all they are not getting it from the food they are eating. They need to get it from the nutraceutical supplements. Okay, and supplements sometimes are quite expensive. So it should always be the aim of the concerned dietitian to give as simplified food as possible according to the socio-economic status of the patient. Yeah, that is what we actually try to do. So far so good. We have to face lot of difficulties regarding the patient's economic status and all, but it is all for their betterment, Now, importance of patient care and dietary counseling. So this is the most important part. Okay, patient care and your dietary counseling. How is the patient supposed to be taken care of in the hospital, and how are you as a dietitian able to do the counseling of the patient? So now let's see. There has been an increased emphasis on setting standards of practice to ensure the delivery of quality patient care. An increased focus has been there on cost control in high healthcare settings for effectively evaluating the patient care program based on two factors: cost effectiveness and provision of nutritional services. Further counseling is one of the most useful methods for assisting an individual to arrive at a solution of his or her problems. Let us get started to learn about the patient care. So now we'll learn about the patient care first. The healthcare team in this process involves a physician, dietitian, nurse, and other healthcare professional. Yeah, like physiotherapist and all, they are there. So how do we define quality of care? On the basis of several definitions in the literature, the WHO definition of quality of care is the extent of which healthcare services provided to individuals and patient populations improve desired health outcomes. In order to achieve this, healthcare must be safe, effective, timely, efficient, equitable, and people-centered. Okay, the patient is supposed to be treated in a very good way. Okay, because if he is not treated in a good way, then the outcome cannot be good. Okay, so it has to be safe, it has to be effective, and it has to be efficient. Now, safe delivery. There are certain points. Now let us see. Safe delivering healthcare that minimizes risk and harm to service users, including avoiding preventable injuries and reducing medical errors. Yeah, like giving many tests and all should be good. একটা test বাবার করা উচিত না, মানে সেটাই আর কি, because when they are giving blood for tests and all, also they also get pain and all, no. Effectiveness, providing services based on scientific knowledge and evidence-based guidelines. Timely, reducing delays in providing and receiving health care. Okay, like proper doctor visit, proper diagnosis, that is what. Efficient, delivering health care in manner that maximizes resource use and avoids waste. In terms of diet as well, you should be able to give that amount of food that the person is supposed to eat. If you give more amount of food and there is wasting of the food, then so that is what we try to avoid. That should be efficient enough to the patient that he does not waste the food. Equitable, delivering health care that does not differ in quality according to personal characteristics such as gender, race, ethnicity, geographical location, or socio-economic status. Yeah, so this is quite important because the patient should not be felt left out because of his gender, race, ethnicity, or geographical location, or his socio-economical status. So all patients should be given equal amount of care and equal amount of good handling. People-centered, providing care that takes into account the preferences and aspirations of individual service users and the culture of their community. So that goes to your patient care. Now we come to dietary counseling. The process by which a health professional with special training in nutrition helps people make healthy food choices and form healthy eating habits. Okay. Other factors that may be accessed during dietary counseling include medical history, including assessment of any nutritional related illness, biochemical and anthropometric measures that we have discussed already, dietary assessment, daily analysis, psychological evaluation, including food related attitudes and behaviors, like how did the person behave to the food that you had sent, those kind of things. Sociological evaluation, including cultural practices, housing, cooking facilities, financial resources and support of family and friends. So this is what we do when the patient is getting discharged, or when a patient comes to OPD. You need to know about the cooking practices and facilities and all also, so that you have a better idea of what the patient is able to eat, or how to cook or how not to cook. So those all. So you can always introduce the method of leaching, blanching, roasting and all to the patients. Nutritional knowledge. Yeah, you should always make the patient aware of the nutrition, the kind of food that is holding. Readiness to learn or change, as well as learning style analysis and current exercise and activity level. Okay, the last point is also important, because there are some patient who comes to the OPD and they are like, I need a diet chart which will get my weight reduced, কিন্তু আমাকে আর কি করতে হবে না, আমাকে এক্সারসাইজ করতে হবে না. But that is not it. When you are dieting and exercising goes hand in hand. Okay, you should always encourage the patient to do as much activity possible. Okay, he can do not like strained exercises which will like dehydrate him or something like that. We should always ask the person or the patient to do some stretchings and all, which are basic PT exercises the person should be doing. So that is how your diet chart will help in getting the patient in a better shape actually. Okay, these are for the OPD patients. And for the endo patients, you have they have activity in sort of, there are physiotherapists who come and give them certain activities, for walking, a slight running or something like that. So these are it. Some of the most common dietary assessment tools that assist in providing dietary counseling include food recalls, dietary recalls, food frequency questionnaires, diet histories, and several other methods, including biochemical indices. A scientific assessment of nutritional status may be made by using a combination of the information collected from the clinical evaluation, biochemical tests, and dietary information. Yeah. So dietary recalls and food recalls means like, when you go to counsel a patient, you should be able to talk with the patient and get the 24-hour diet recall, like what the patient has had in the last 24 hours. What does he eat? What is his eating timing, eating habit, all those kind of things. Okay, so when you do clinical practicals and when you go to the wards and all, you'll be knowing about it much more in a much better way. So these are just like upor theke porachi arki. Factors that play a major role in contributing towards motivation: physiological factors or psychological factors. Okay, now there are some factors which hinders, or which may not which poses as a threat for you to talk with the patient or adhere the patient in their nutrition development. So psychological factors like depression, anxiety, phobia induced by the illness, lifestyle changes or medication effects may comply to hinder the desired health behavioral changes. Yeah, there are some patients who are in depression, anxiety and phobia. They do not actually recall like what they have had, what they are able to eat. So there is a barrier with them. Like you cannot go and talk with the patient, okay, they are not free with you, they cannot express what is going on, so things like that. Psychosocial factors. This may prevent patients from expressing concern for their health. They may lack confidence in the health professional or simply be unable to cope with the dietary changes at a particular point of time because of the degree of illness or personal problems. But this you can overcome. Okay, some patients like that, they may lack confidence in health professional for a certain period of time, but when you go to the patient, when you talk properly to the patient and introduce yourself as a healthcare professional, and even when there is empathy with the patient, like when you express your empathy to the patient, then they automatically trust you, and they will like share with you like what the problems they are having, and they'll ওটাই ওরা করবে, মানে বেসিক্যালি ওরা তো সিম্পাথি চাইছে না, ওরা এমপ্যাথি চাইছে আর কি। তো ইউ হ্যাভ টু কিপ ইয়োর সেলফ ইন দ্য পজিশন অফ দ্য পেশেন্ট অ্যান্ড থিঙ্ক অ্যান্ড টক টু দেম অ্যাকর্ডিংলি। ওকে, তুমি ফোর্স করতে পারবে না কাউকে, তোমাকে আস্তে আস্তে করে শুরু করতে হবে কথাটা। Physical factors. The drugs or illness may induce pain, fatigue or depression which might block desires for ability to follow a health professional. এটাও কিন্তু শুরুতে এরকম হয়, এটা নট নেসেসারি যে সবসময় তোমার ওই ড্রাগস বা ওই ওষুধটা খাচ্ছে, বা এরকম কোনো টাইম নেই যে পেশেন্ট অসুস্থ হয়ে শুয়ে পড়েছে। হ্যাঁ, দের আর টাইমস দ্যাট দ্য পেশেন্ট ইজ অ্যালার্ট অ্যান্ড জেগে আছে, তো ইউ হ্যাভ টু গো এট দ্যাট টাইম টু টক টু দ্য পেশেন্ট। সো দিস ইজ হোয়াট ইজ রিকোয়ার্ড, a little bit of your personal concern is also required as a dietitian. Personal factors. There may be language barrier or a lack of transportation or money for clinical visit. Yeah, this it's a খুব common for people living in rural area, and also for people in urban area. Okay, with urban area people do not have lack of transportation or lack of money. In rural area there is a lack of transportation, and they basically do not have money for clinical visit and all. But language barrier is definitely posing a threat for it's creating a hindrance for the interaction between you and the patient. So what you can do is, like, if you have a colleague among you who can talk in the same way or in the same language, so you can go and take him or her with you to the counseling, so he or she may, or your colleague may translate what you are trying to say and talk with them. So that is one thing. And for the lack of transportation and money for clinic visit, this are areas which should be like actually concerned by the rural this panchayat and all, so they should be working on it. Consider related factors. A personality conflict may exist between the patient and the counselor. Sometimes there is a personality conflict between a patient and the counselor, but you are the more, you have to be the more educated or the greater being here, and you need to keep all your conflict aside, and you need to treat the patient as a patient, and forgetting everything, just you need to remember that he is a patient or she is a patient, she is in pain, he is in pain, and you need to go and do the counseling. Okay, so that is it for today. This is your, I hope you have no doubts regarding the medical nutrition therapy. So if you have any doubts, so we can consult later. Okay, so thank you.